Hello, and thank you for joining us for episode 12 of Mazars Healthcare Digest. My name is Jacki Jacox, and I'm a CPA and Director of Healthcare Consulting and Financial Advisory at Mazars. One of my areas of expertise is in the independent valuations of provider compensation, fair market values, and commercial reasonableness. Today, I'm going to discuss how you can visualize the risks associated with provider compensation arrangements when performing a risk assessment. Physician compensation arrangements are highly regulated, and when they're out of compliance, the consequences can be catastrophic to an organization. Performing a risk assessment of your provider compensation contracts is key to maintaining compliance. I was first introduced to Heatmap methodology when I was in external audit. We often use this when mapping out risks associated with internal controls. I decided to take that same concept and apply it to provider compensation arrangements. Heat maps are an excellent tool to use in risk assessments because a human eye detects color differences much faster than it would in digits or numbers for that matter. The purpose of my presentation is to encourage you to consider using a visual technique when performing a risk assessment of your provider compensation arrangements. When looking at the key laws and regulations, the U.S. Code is made up of the official federal statutes of the United States and contains 53 titles. These are all laws passed by Congress. The DOJ recovered over $2.2 billion from False Claims Act cases in fiscal year 2020 alone. So over 1.8 billion of these losses were due to cases within the healthcare industry, and many of which included Stark Law and anti-kickback statute violations. So this monetary benchmark is not only for federal losses that it mentions, but then the DOJ helped state Medicaid programs retrieve an additional tens of millions of dollars from False Claims Act violations. These sets of laws are designated to regulate the financial relationship between healthcare practices, doctors, hospitals, vendors, and other healthcare companies. The purpose of regulating provider compensation arrangements is to protect patients and federal healthcare programs from fraud and abuse by mitigating the risk of corruption due to the influence of money on decision-making. Recent updates to these governing regulations for provider compensation has shifted our focus from the big two to the big three. And really with this shift, CMS introduced the volume or value standard as a separate and distinct concept from fair market value and commercial reasonableness. And in addition to these changes, a new Stark Law regulatory definition was added for commercial reasonableness. A heat map is defined today as a graphical representation of data where variations in values are displayed as variations in colors on a color scale, with different color hues and color intensity levels. Heat maps provide an effective and accurate visual summary of data, and as I mentioned earlier, a human eye detects color differences much faster than digits. And so it not only provides decision makers a visual big picture view, but it also helps support making the strategic decisions and measuring and prioritizing risks so that your risk levels are being managed within defined tolerance thresholds without being over controlled or over foregoing desirable opportunities. So you'll see here the map provides two-dimensional representation of risk. So you have impact plotted against likelihood. So the vertical y-axis represents the potential impact or consequence that the risk might affect the enterprise. And the risk is measured from insignificant to catastrophic impact. And the impact of a risk can be assessed from many different angles, such as monetary or reputational. The x-axis or horizontal represents the likelihood or possibility that a given risk, event, or consequence will occur. The likelihood of a risk is measured from rare to almost certain chance a consequence will occur as a result of the risk. So the way I look at this map is from low to moderate to high. So your low, or the green area in this instance, is an area where you would accept or reduce your risk. In the moderate section, or the yellow, would be where you would want to monitor your risks. And then in the high quadrant, or red area, is where you would want to mitigate your risk. And then as it moves towards the yellow, that's where you would manage your risk. So utilizing the risk assessment heat map methodology, now let's look at how this can be applied to assessing provider compensation arrangements. The COSO Enterprise Risk Management Framework provides guidance on risk assessment process and is really geared towards achieving an entity's objectives, including compliance with applicable laws and regulations. A risk assessment is a term used to describe the overall process or method where you are identifying hazards and risk factors that have the potential to cause harm. So this would be your risk identification, and then analyzing and evaluating the risk associated with that hazard. So this would be your risk analysis, and then determining ways to eliminate the risk hazard, or control the risk when hazard cannot be eliminated. This would be your controlling of the risk. This process should be simple, practical, and easy to understand. It should be performed by management with the right knowledge and expertise. And risk assessments are done when leaders at various levels can utilize the information to make business decisions. So really here, the phases that I have set up for provider compensation risk assessments for heat maps would be: phase one, develop your risk assessment by mapping out several provider compensation components and scenarios common for your organization. And then phase two would be assessing those risks associated with each compensation arrangement and map them out according to the criteria developed and using the color-coded system below. And then phase three would be responding to the risk. So that would be anything that you see in the moderate or high risk range. You would want to start managing and mitigating those risks and reviewing those provider compensation contracts. Here's an example of green, or a lower risk provider compensation component that would be considered when mapping out your provider compensation contracts. So compensation in this scenario would be supported with an independent fair market value and commercial reasonableness opinion. So as an outside vendor, I would be able to come in as an independent and free from bias source. And as an experienced healthcare valuation expert, we are able to assess and render opinions on the fairness and reasonableness of the compensation. And experienced valuators are widely used and accepted valuation principles, resulting in defensible results. So really, it's just a matter of shifting your risks of fair market values to a third party. Here's an example of yellow, moderate risk provider compensation scenario. And in this scenario, compensation is in excess of the 75th percentile of survey data. So CMS clarified that even if compensation is set at or below the 75th percentile, that it is not always considered fair market value. And unfortunately, they would not provide a safe harbor for the Stark law. So therefore, compensation arrangements should be reviewed on a case-by-case basis. The facts and circumstances must be deemed reasonable based on the services provided. So for example, if a provider is compensated at the 75th percentile like we have here, but their productivity is well below the 50th percentile, and they are not performing any other services other than clinical activities, their compensation may not be considered fair market value because their services do not line up with their compensation. So here's an example of a red or high risk provider compensation scenario. And again, this would be taken into consideration when mapping out where your contract overall would end up on the heat map. But in this example, let's say compensation is paid per work RVU with no established threshold. So now let's use a hypothetical scenario. An invasive cardiologist produced 15,000 annual work RVUs, representing the 90th percentile of the survey report. The provider is then compensated using the 90th percentile compensation to work RVU ratio. Let's say that's $100 per work RVU, which equates to total annual compensation of $1.5 million, because you would take that 15,000 annual work RVUs times $100, which would end up in 1.5. The same survey report then reports that annual compensation for invasive cardiologists at the 90th percentile is $900,000. Using this compensation methodology, the provider received $600,000 of compensation in excess of fair market value. So these are important reasons for why employers will want to cap the total work RVU based formula, or go away from it completely, because it's fairly common, should you do pay per work RVU and not establish any thresholds, that you could end up well above what fair market value is for annual compensation. On this slide, we have a provider compensation heat map where I've identified contracts using the impact versus likelihood matrix. And on here, this is the heat map methodology, where we are just mapping out the physician contracts, which you can see they were given, a key code with, in this example, they start with C and end with a number, and each of these are representative of one provider compensation contract. So in this example, the likelihood represents the possibility that a provider compensation arrangement is not in compliance with laws and regulations. So this would be rare to almost certain. So rare would be in the green, and almost certain you end up in the red. And impact or consequence refers to the extent to which a risk might affect the organization. So this is on the scale of insignificant to catastrophic. So at insignificant, you would be in the green, and then catastrophic is where you end up at the high end of the scale, or red. And this is an example of a hospital risk assessment heat map for all of their provider compensation arrangements for both employed and contracted providers. Each provider arrangement is assigned a key code and plotted on the map based on the risk score. So the risk score is then developed based on the risks associated with the specific compensation components and contract language used. So this map is then accompanied by a full report that provides a deep dive into the risk scoring components that were considered for each provider compensation arrangement. So using this heat map, the hospital executives and compliance officers were able to measure and prioritize their risks, and they were able to shift their focus to reviewing and updating the provider compensation arrangements that you would see in the upper right quadrant. And so they did those first, and then they were able to work backwards to mitigate, monitor, and manage their contracts that were mapped in the other quadrants. So in essence, the idea around the heat map methodology is that you're able to look at the heat map and say, okay, all those in the red area are the ones that we need to mitigate and review immediately, and then you work backwards from there. So here I've outlined some key takeaways to consider for provider compensation arrangements. So first off is to stay up to date on your provider compensation laws and regulations. They will help you make sure you're staying in compliance and updating contracts as regulations change. And then I highly recommend using the COSO ERM framework, where you have a three-phase risk assessment approach, using developing your risk assessment criteria, assessing the risk, and then responding to them. And then review your existing provider compensation risk assessment process and consider implementing a heat map approach to better visualize your risks. And then identify, assess, and respond to those risks that you identified as moderate to higher risk. And for the moderate to higher risk arrangements, consider obtaining an independent fair market value opinion to better support the agreement. And also consider setting up compensation and or percentile thresholds to help determine the risk of an arrangement, triggering the need for maybe a compensation committee review and approval, or even an outside valuation approval. Thank you again for joining me. And I know aligning provider compensation with regulations and organizational goals can be a very daunting task. So just know that we are here to help you through this process in whatever capacity you need to best mitigate your financial and reputational risks of violations. So again, I'm Jacki Jacox. I'm a director at Mazars, and I've included my information here. And then also I have a QR code, which would lead you to my virtual business card. And thank you again for joining me today, and have a great day.